Hey guys, my name's Grace. The title of my outcome study is Impact of In-Service Education on Dietitian Referral System. So I came up with this idea for my outcome study during my first week at my clinical rotation at OSF St. Mary's in Galesburg, Illinois. One of the first days when my preceptor and I went to rounding with physicians, other healthcare professionals, the nurses, a doctor was presenting on a patient who was in the hospital for diverticulitis. And my preceptor spoke up and said, "Hey, we didn't get consulted for this patient. Do they need education on a diet for diverticulitis?" And the doctor respectfully questioned my preceptor, just asking, "Well, what kind of advice are you going to give them?" And my preceptor went through the steps for diverticulitis, going from a full liquid diet to a high fiber diet, and the progression that is necessary to help prevent further diverticulitis outbreaks. And the doctor just had no idea that that was the recommendation diet-wise, and that there was more to it than just looking at fiber content. So leaving that rounding meeting, I asked my preceptor if that happens often, if she feels like there are consults that are missed, that there are referrals that don't get to her that should, and she definitely said yes, that there were numerous times where she felt during rounding that there were patients who could benefit from dietitian services but who were not getting referred to her. So going into some background information, hospitals are required to employ a licensed, registered dietitian to provide and fulfill nutritional needs of patients. In addition, the Joint Commission requires that a nutrition screen be performed on all patients to determine potential nutrition problems and to provide appropriate intervention for those problems. So it is recognized that dietitians are a valuable team to the hospital setting. In a study that I was looking at that I referenced in my references, it was assessing dietitian referrals by primary care providers. And it concluded that beliefs that an RDN had an important role in the treatment or management of chronic disease was associated with a higher RDN referral rate. So this was just a study that I looked at to kind of compare my study with. The overall problem and purpose. So the dietitian referral process at OSF St. Mary's has been underutilized by physicians, nurses, and other healthcare specialists at the hospital. So the purpose of my outcome study was to increase the number of appropriate referrals to the dietitian. And specifically, I wanted to do this through an in-service education with the healthcare professionals at the hospital. It was kind of a challenge determining who to give this in-service education to, as nurses spend the most time with their patients than doctors or social workers, case managers, other professionals in the setting. However, nurses are also the hardest to get around because of their odd schedules. Some nurses only ever work nights. So just thinking through that schedule was challenging. So for my method, I ended up speaking with nurse managers or the charge nurses on the 2 floors with inpatients at the hospital. So floor 3 and floor 4 were the 2 floors in the hospital that had inpatients. And I created a brochure, which I have a picture here of one side of the brochure. And the brochure included the role and purpose of a dietitian in the healthcare field, the importance of medical nutrition therapy and overall health status, diseases and conditions with high risk for nutrition intervention, and the process of referring a patient to the dietitian, how they can do that, and the number to call. So the in-service education was performed face-to-face with the nurse managers, and then I provided cardstock color copies of the brochure at nursing stations in the hospital. So I had printed off a number of copies and placed them myself on the different units on the floors. The way I collected data, I used Microsoft Excel. So every day I would circle or mark the consults that we had received, and then I would go through the nutrition screening assessment on the census and see which patients were tagged for nutrition risk, and would include those in the missed consults if we weren't consulted for them. Or I would also go through and see if there was any low BMIs, any of those at-risk patients for medical nutrition therapy that maybe weren't tagged on the nutrition screening assessment when they were admitted into the hospital, but that I saw could potentially need medical nutrition therapy. Also, rounding was very valuable for collecting this data due to just hearing the physicians and the nurses speak about their specific patients. They gave a lot more detail than just a piece of paper would give me for patients. So every day I recorded the number of consults we received. I determined the number of consults missed, and in the end, I calculated the averages for before and after the intervention. For my results section, I have 2 bar graphs. So the top right bar graph is showing the average consults and missed consults per day. So the blue bars are the number of consults we received in total before the in-service education and after the in-service education. And then the orange is the missed consults that I had recorded. So you can clearly see that there was a drop in the missed consults following my in-service education. Now, I used an average number over the total amount of days. So the drop is 1 person per day. In addition, I included the bar graph on the percentage of patient consults missed before and after, and you can see there was a decrease by 14% following the in-service education intervention. So the data collected confirms that an in-service education on the role and purpose of a dietitian in the hospital setting had a positive impact on the number of appropriate referrals to the registered dietitian on staff. In conclusion, the outcome study again demonstrated how an in-service education positively impacted the number of appropriate referrals. The average number of missed consults decreased by 1.03 patients per day, or 14% following. So this is a noticeable improvement. There were a few limitations that should be noted. One of these being the impact of COVID-19. So COVID-19 occurred just after my intervention, and with that, the hospital completely closed down one of the floors. Therefore, only one floor was housing inpatient patients in the hospital. So the census had dropped drastically, just leaving the number of people at risk or to be consulted for at a much lower number. Another limitation is the inability to know how many nurses actually read the brochure. So I talked to charge nurses and nurse managers. However, I don't know the number of nurses on their floors who read the brochure or who picked it up and looked through it. A third limitation was the subjectivity of the missed consults. I realized that there is potential that some of those who I counted towards missed consults maybe didn't necessarily need a missed consult due to judging patients based off their medical information given on a census report. So that could have influenced the number. But overall, from this study, we know that education on the role and purpose of the clinical dietitian to other healthcare professionals has a positive impact on the referral system. I really enjoyed learning and implementing this education to the nurses, just to work on trying to reach more people and having a greater impact at OSF St. Mary's.